okay.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. Beautiful looking Thursday. Just a little bit chilly, but that's nothing to worry about. We've had so many different people telling us different things that they're doing for the New Year's resolutions, and one of them is beginning an exercise program that includes running or jogging, and if knees are an issue or will become an issue, or maybe you want to learn how to prevent them from becoming an issue, this is a good time to listen. Our friends are in the studio, Brittany Marthaler and Leah Caruso. Brittany is the communications manager at Ocala Health, and Leah, of course, is the clinical operations manager at Strive Rehabilitation, and the two ladies have brought in some guests to educate us about our knees. Robert Lonadier, you've been here before, correct?
Yes, sir.
Good to see you again.
Thank you.
You are, you're with the hospital, right?
Yes, sir. The clinical coordinator for the orthopedic department.
All right, and Jeff, you're new. Jeff Nasman is here?
That's
Are you
correct.
Dr. Nasman? Do I say doctor?
You can call me either one.
Okay, all right. So
Dr.
Dr. Nasman and two doctors, right? You both doctors? I don't know. Just making sure I have everything right. I'm trying to be polite. Well, yeah, knees are, I mean, what do? Your knees hurt? Good morning to both of you.
Good morning.
Can I, straight out of that box, ask you a question about knees?
Sure.
Because we know a guy who had stem cell therapy to fix his knees. Is that... tell me about that. Is that? I mean, he's swearing by it. He said it's the best thing that ever happened to him.
There is some, I'm not up to date on all the research on the stem cell. I know they've been looking at it for quite some time, and they have seen some good results with it. But recent research, I haven't seen any of it.
Okay, and so is it something that you recommend, or is it? How do you get to that point where you say everything else isn't going to work, or is it a first thing you do?
No, I think it's one of those tools in the toolbox that you can pull out if necessary. The first thing you probably need to do is do some preventative work, get in shape, do some good flexibility, range of motion exercises, some strengthening.
Yeah.
And then, if you start having some knee pain, a good stop is some physical therapy, a conservative treatment. And then you just kind of progress through the levels or layers of care. And the PRP, there is a physician in town that does do that, and that is a good option if they're a qualified candidate for it.
And so the typical knee injury, the pain from an injury, whether you fell or maybe you were in an accident or something like that, I'm guessing that's different than the wear and tear simply from getting old?
Yes, yeah. I mean, it's acute injury versus chronic, and if you fall, you can and tear a ligament or just strain a ligament. A strain is a small little tear in the ligament, but it's not a complete rupture. I misspoke. It's a sprain. Is a small little tear in the ligament, not a strain. That's in the muscle. But either one of those can typically be rehabbed pretty conservatively. Complete rupture of the ligament or the tendon would probably require surgical intervention.
So surgical intervention, that would be first, and then the rehab would be afterwards?
If it's not always. I mean,
Not always.
Many times that you can do conservative treatment on tears. I know they now are not rushing them to surgery right away with, for example, a medial collateral ligament sprain. You might do some conservative therapy and it might heal up on its own.
Oh, really?
Without surgical intervention. But there are cases, for example, an ACL rupture, depending on your circumstance, would most likely necessitate a repair. Not necessarily. Some people that are advanced in age and don't necessarily need the ACL or aren't involved in rigorous sports, sometimes they don't do surgery on those. So it really depends on the circumstances, but more likely to involve surgical intervention if you have a complete rupture.
And Robert, when a person feels like they have something wrong with their knees, would they be able to come to see you and you can evaluate them?
Yes, ma'am. Well, a good thing about knee pain and stuff that you don't need a referral from a physician to go to an orthopedic surgeon, so you can self-refer to those.
Oh, really?
Like that. So that's a good thing. But you just come in and they do an exam and stuff right there. Because I'm the orthopedic nurse at the hospital, so we refer them out to the different surgeons around town. Depending on, we get calls daily at the hospital asking about different pains and stuff like that. We refer them to different surgeons that may specialize in that area right there. But so they go in and get a thorough exam and testing and stuff, because it could be anything from simple strains or sprains to like bursitis or tendonitis, all the way up to osteoarthritis, which is the most common cause.
Most common, but
right
you put
there.
it at the top. Is it at
Yeah.
the top because it's the worst?
It is, well, right now they say by like 2020, probably like 58 million Americans in the U.S. will have some type of osteoarthritis right there. But it's I think it's one of the top 5 causes of deformity or people
really?
out at work and stuff
Can
right there.
that be
So-
prevented? Can arthritis be prevented?
Well, it's mostly wear and tear for osteoarthritis. So
Oh,
it
really?
depends on how active you are right there. The more active and bigger you are, you put more strain on your joint right there. The knee is the biggest joint in the body, so it's a hinge type joint. So for, say, like every pound that you weigh, you're putting about 4 pounds of pressure on your knee.
Oh, wow.
So, just by doing some simple things.
My knees must be begging for mercy.
So, just like, losing like 10 pounds, you'd take 40 pounds of stress off your
Oh,
knee
wow.
right there. So
Oh,
like
wow.
that.
Why is that? Why is it 4 times as much?
What's that, Jeff?
I don't understand that.
As the angle changes as you're going through, normal activities. You mentioned first thing. Are there preventative things that you can do? Yes, you can slow down the wear and tear of the knees by exactly what Robert alluded to. Staying fit, doing some exercises, including range of motion and strengthening exercises of the knee. Osteoarthritis will occur over time, but to get into the physics of it all, as you bend the knee, it increases the pressures, and each pound that you have in addition will multiply the forces at the knee. So
If you go to the vitamin section in the grocery store, I know you know where I'm going, but there's a product there. It's for knee health. I can't remember what it's called.
Osteobiflex.
Okay.
I think it's
I don't
that.
know.
probably glucosamine.
Yeah,
That too. Yeah, I've seen that word too.
well for joint.
Yeah.
Do these things work? I mean, do they make a difference?
Anecdotally, a lot of people swear by it. There is some research on them, and it's not equivocal. It's not anything out there that says, yeah, this is definitely going to work.
Oh, really? Really?
I've talked to a fair amount of people that have anecdotally said, yeah, I've received relief, but I don't think it's a slam dunk like many people.
Sometimes people won't get their knees replaced because of their fear that they're not going to be 100%. How do you alleviate that fear?
Well, we do patient education at the hospital. We have like pre-op or knee classes that we talk about surgery or what you can do, what you can expect. But most time is when that person gets to that point where they can no longer take the pain, that's when they're going to have the knee replacement. They'll put it off for 3 to 5 to 10 years until they just can't take it
Wow.
anymore. I know patients have gone to see some of the surgeons in town, and they're just not ready for that knee replacement, even though that they need it. And they'll say, well, I'll see you when you want it. And they'll come back in 3 years and just say, I can't take it anymore. I'm not
really?
able to do the activities that I want to do. I can't play with my grandkids. I can't go on a cruise. I can't walk around the neighborhood. And then they're ready for that surgery. So when they're ready for it, they're ready for it.
Yeah, yeah. Even if the women at the beach compliment you on your knees, you
That's
say,
right.
well, they're fake. They're not real. We have to take a little break, and we'll be right back. We have a weather report, and then we'll be back. This is the Source WOCA. We do have a caller. Just hang on just a second. We'll be right back. This is the Source WOCA.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, times of clouds and sun, breezy and quite cool. A brief shower or two in parts of the area. Highs ranging from 51 in the northernmost part of the zone to 63 in the southernmost part. Partly cloudy and quite chilly tonight. Lows ranging from 38 across the interior to 54 on the coast. For tomorrow, times of clouds and sun. There may be a shower in spots near the coast. Highs ranging from 59 up north to 72 in the south. From the Florida Weather Center, I'm Joe Lundberg.
The Ocala Civic Theater presents Sleuth. The mystery is in the wits of the two young rivals that battle each other to commit the perfect crime. Predator becomes prey, and this diabolical thriller blends danger and dark humor. The tension builds with every riveting plot twist and illusion. Sleuth at the Ocala Civic Theater on stage January 8th to January 18th. Call the box office at 352-236-2274.
Real estate is the largest and most personal investment that any of us will ever make. Be sure to tune in Tuesdays at 10 a.m. when Bob Kennedy, owner of Berkshire Hathaway Home Team Realty, will be answering your questions and discussing real estate. So remember, that's Tuesdays at 10 a.m. Call 622-9622 with your questions. It pays to be an informed buyer or seller. This is news you can use from Berkshire Hathaway Home Team Realty and your friends here at WOCA.
Stay informed on everything going on in the Villages with the Village Spectator newspaper. The Village Spectator is exclusively devoted to the Villages with news, commentary, and more. And yes, they have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask is that you tell them where you heard about them. Call Tom's Picks at 804-1223 and pick up your copy of the Village Spectator today.
Now read Ocala Downtown newspaper online.
All right, 16 minutes after 11 o'clock. Thank you for tuning in. I have a phone call, but real quickly, let me reintroduce our guest. Dr. Jeff Nasman is in the studio with Robert Lonadier. Am I saying your name right, Robert?
Yes, sir.
Okay, and they're here to answer questions about knee problems, knee pain, knee treatments, and et cetera. So let's go to the phone. Thank you for waiting, by the way. Good morning. You're on the air.
Yes, good morning. Both of my parents suffered from arthritis. Is there a hereditary factor involved in that I'd have to worry about?
Hold on one second. The doctor can't hear you. Robin is fixing his headphones. Can you hear now, doctor? Can you hear me? No. Let's see if
I can hear you.
Now you can hear. Now, okay. Yeah. Go ahead. Say it again. I'm sorry.
Sure, no problem. Both of my parents suffered from arthritis. Is there a hereditary factor involved there that I have to be concerned with?
I mean, that would play probably some part in it. It's probably more likely to be determined by your activities, more so. But there could be a factor involved with that, with hereditary.
Yeah, because with osteoarthritis is known as the wear and tear arthritis, so it's more strain and activity level. The rheumatoid arthritis would be more of a hereditary marker.
If you have the start of arthritis in your knees and you got knee problems, and you let's say like you take Aleve every day, like the commercial says, to alleviate pain, is that bad to do that, to leave that situation really unchecked?
Well, yeah, I think anytime you're taking medication on a regular basis, that's my personal bias, being a physical therapist and coming from, activity-based interventions. I would like to see people try as much as they can conservative interventions if possible. So if it's a long period of time, yeah, I would say, and a leave here or there to get you through a day, a tough day isn't, the end of the world. But if you're taking it regularly to survive day-to-day activities, then I think it's probably in your best interest to have your knees checked out by someone who can make sure biomechanically that you're doing things the best that you can, and that flexibility, range of motion, and strength are all what they should be.
All right, thank you for the call. The phone lines are open, by the way, if you would like to call in, 622-9622. You don't hear this anymore. Water on the knee. What was that, or what is that? Water. Have you ever heard of that?
They probably talk about was nursemaid knee, right? Milkmaid knee. That was
that sounds better.
Inflammation of the bursitis. Yeah. Well, we don't see too many milkmaids with bad knees anymore. But what is the inflammation of the bursitis? You have the bursa sacs around the knee, and they come inflamed and swell up. What I really see them now is in young guys. I've seen it more in like carpenters or floor tile layers and stuff. And they don't wear the knee pads, and they're always on their knee, and it gets inflamed right there, and it causes the pain. But those kind of simple things like that, they could usually be treated with just a rest or ice compression, maybe using padding for your knee and kind of protecting that right there. So
it may be a general reference to just swelling or joint inflammation in general. But yeah, the bursitis is, well, you see it in young athletes too. Sometimes I just saw a wrestler a couple weeks ago that had, impacted his knee to the mat, and it caused a bursa to swell up, and it looks really.
And what are you saying? It caused a burst to swell up?
The bursa. A bursa is a sac in the knee that is has lubrication and helps the ligaments and the tendons glide easier. So.
Is an elderly candidate, say of retirement age, a good candidate to come in for knee surgery?
Definitely. We see it all ages now, but several years ago, they would not hardly do a knee surgery until you were like 65, 70. But now, with the new implants and stuff, they're lasting up to 30 years. So we're seeing people all the way down into their 40s, all the way up to 100. But her retirement community is like her big age for doing the surgeries, like 55 to 70. We're that's like our big population.
So what happens
right there.
if you're 30 years past your surgery, it starts to break down? Do you hurt again?
You could do a knee replacement. We could go back in and maybe change out some components in it right there. Sometimes maybe the liner wore out or something, so we could change those components and just kind of revise what was done before.
And if you need to have both knees done, do you do that at the same time?
We do that. We don't recommend it for everybody, but some people like it better. Go ahead and just get it over with, because you have harder time with therapy, not having both done at the same time. But we do probably about maybe one a week that does a double knee right there, and they just come in and get it. A lot of people put them off for about 6 to 8 weeks in between them right there. But we still do the double like that. So.
And how long is the recovery time after a knee replacement?
Well, you've been in the hospital about 3 days average now, but total recovery is like 6 to 8 weeks. You get back to your get back to good function, but you'll have recovery all the way up to that first year after surgery. Still working on your range of motion for that first year.
Oh, really?
Wow.
So how do we know where to go, doctor or physical therapy? How do we know? I mean, do we go to either one of you guys, and then you kind of determine where you need to see somebody else? And
either one, because they refer. If a therapist thinks you need more care, they're going to refer you to the physician, and the physician thinks that go start you out with conservative care first, because you never want to go to a physician that the first thing out of his mouth is he wants to do surgery. You always want to go through the steps.
Okay, that's a good rule of thumb. Okay, we'll remember that.
So that's a good plan to run if they say that right off the bat. But so you go through the conservative care, like some therapy, maybe changing your modification of your behavior, doing maybe even putting lifts in your shoe or bracing, and going through your drug therapy like your NSAIDs, like your COX-2 or your aspirin or your Motrin, all the way up to cortisone shots, and then going to the knee replacement. So you kind of do like a stair of going through the motions before you get up to that total knee.
Are there side effects to the shots?
Well, some people have pain from the shot right there, then some people don't. It just kind of depends on how their body works.
That sounds painful. So. I mean, you put the needle underneath the kneecap?
Right into it, yeah. So it is painful.
What is it?
Yeah.
Oh, it is painful. Oh, you had it done? Did you have it done?
I had a cortisone shot once on my foot.
Oh, you did?
Oh.
He said, this is going to hurt. He's not lying.
Oh, it did hurt. It hurt a lot? Oh, wow. What is cortisone? What is that?
It's a like steroid drug right there. So usually most people, they'll have up to a total of 3 of those before they have surgery, but sometimes they don't like, maybe if they don't like the first one, they'll go to surgery after that one right there. But once they come into the office, we get an x-ray, and that's going to really show a lot how that knee's looking in there, if you have any cartilage left or anything, and that would determine whether you need a total knee replacement, or you may be a candidate for a partial knee replacement, only have to get a half a knee replacement. So,
really? So give us a kind of paint a picture of who the ideal patient is when they have a knee problem, and then if you wouldn't mind giving us the worst patient, somebody who does everything wrong. Yeah.
The worst will probably be me when it's my time, but right there, it's not like that. So
why do your knees hurt?
I just turned 50, so I got the knee pain going into us. So, and then being a nurse, that they're the worst patients to begin with, right there. So I have it all right there. But like the ideal patient is going to be probably somebody about 60 years old that was active most of their life. That wants to continue their activity, maybe running with their grandkids, riding bicycles, doing some sports, that wants to get that activity of daily living going, and that kind of lost that motion because of their knee pain. Right. And they come in and have the surgery and either go home with rehab or go do some outpatient rehab, or even go to a rehab center for a couple of days and then back home and getting their life started again.
So a lot of times you hear a doctor say that when you are like in the hospital, it's better to move around. Like the old, years ago they would say stay in the bed. Now they say walk around, move around as much. With knees though, how do you do that? I mean, how do you walk around?
Absolutely, we get them up. The standard now is getting them up the same day of surgery. So they might come out
even with the knee surgery. Oh,
even
wow.
with the knee, they might come out of surgery from a total knee replacement on 1 or 2 o'clock in the afternoon, and by 4 o'clock we'll sit them up on the edge of the bed. We might transfer them to a chair. Occasionally we'll get them up and walk them to the bathroom. Sometimes they're ready to do that, sometimes they're not. But the main objective for rehab after the surgery in that acute hospital stay is to get them moving, make them safe with their assistive device, whether they're using a walker, which is the majority of the case, or sometimes a cane. Get them walking a safe distance.
Right.
Get them safe up and down stairs, so when they go home, they can be safe in their living environment.
The floating kneecap, the one that moves around.
The patella. Mm-hmm.
Okay, is that the brace? I guess that you can get at the CVS and stuff. Mm-hmm. Is that what that's for to keep that in place?
Well, there's multiple braces, but yeah, that's probably some type of a brace to keep the patella in tracking in a certain.
Why would that ever move around though? I don't remember mine ever moving around.
The patella? Well, it's supposed to move around. It's
supposed to.
Yeah, it's supposed
really?
to. But the problem becomes with wear and tear. Sometimes it tracks incorrectly. Sometimes there's muscle imbalances that create an awkward pull on the knee, and that will cause some pain. And so those braces are designed to try to help minimize that and have it track a little bit better. There's also exercises that you can do that might help with the tracking as well. And so that's the purpose of those braces. Sure.
Go ahead.
So sometimes babies are born bow-legged, and then you have to do different exercises to straighten out the legs. Can you guarantee that their knees will be in good shape then when they're all straightened out for those exercises? Do you do that kind of therapy?
We don't do that kind of therapy. That's pediatric intervention. And there are some places that do it. There's probably, they say there's no guarantees in life, and you probably don't have that guarantee, but it certainly would probably be in their best interest and reduce the chances that it might track abnormally. But of course, we won't know that until they grow. Many times, the kids they'll grow out of it,
Oh,
really?
with a little bit of guidance and with some exercise and some bracing, but we don't do that as much as we used to.
We've got about 2 minutes left. I want to make sure that we get the information out so that we can have the listeners who didn't want to call in actually call you guys and get their questions answered. Does insurance cover everything we've talked about today?
Depends.
Yes.
Mm-hmm. Yeah.
Okay. I wasn't sure about the rehab. I mean, the rehab insurance covers rehab, right?
Yes.
Yes.
Okay.
Yes, it does.
But knee surgery is not ever elective, right? Nobody ever chooses to do this.
Most of them, they're all elective right there. So
they are?
Yes, sir. Unless you have like a trauma or something like that. But otherwise, it's an elective procedure.
Is it right?
Yes,
So you don't need it?
No.
But how do you live with a pain like that?
That's why they have it right there. So we probably, in the U.S., probably this year, 2014, they probably did almost 700,000 total knee replacements. And they're saying by 2020, they're probably going to be about 1.5 million a year right now. So,
wow.
Right there, so.
Wow, that's a lot. All right, so who wants to give out the contact information? Brittany?
If you want to be referred to an orthopedic surgeon, or if you'd like to get in touch with Robert, you can call our consultant nurse line. It's 800-530-1188. And for more information on our orthopedic joint care program, you can go to our website at ocalahealthsystem.com.
All right, excellent. Well, thank you guys for coming in, and Happy New Year. Haven't seen you all year, so.
Thank you. It's always a pleasure.
Use my joke again.
Thanks for having us.
And Brittany and Leah, thank you for what you do. Do you want to give out information, Leah?
Sure. I'll give out the Mary Camp Clinic location is, the phone number is 352-351-8883. And then you can check out a location that's convenient for you at our website. It's www.striverehab.com.
All right, excellent. Leah and Brittany, and Dr. Jeff Nasman and Robert Lonadier, thank you all for coming in. We'll take a little break. We'll be right back.